There are so many stories that I love to share with my patients to help them understand and embrace this idea around pain and how we interpret pain and how we anticipate pain and how that affects our experience. But first, I will start off with an illusionist. There was this illusionist, I saw this on a documentary somewhere where they basically had this guy and he's sitting and they have him set up where he believes that his arm is sitting on the desk in front of him, where in fact it's a reflection. He has a mirror set up and it's a reflection of his arm. At which point he takes a hammer and he bam slams that hammer down onto what he thought was his arm. Obviously it was not his arm, but he screamed in agony and in pain because his brain connected the dots, because that's what it's supposed to do, as to what it was seeing and what it would experience. And he felt that pain. He literally felt that pain, even though that hammer didn't touch his arm at all. The brain remembers memories of feeling and sensation and of pain and of suffering. And when it thinks of it, it connects that dot. And it's not make-believe. It's not in your mind in this way that we think of it, but it really is what your body will react and feel. The memory, the thought of it will trigger the same sensation. Think of it as if you are having a very sour candy. What happens? Your mouth salivates and your jaw hurts, right? Even thinking about that same candy will make you have that same response. It's a legitimate response to an experience that's not really occurring or happening. I literally feel like I see that in my clinic. Okay, maybe not to that extreme. They're not yelling and screaming as if they've been hit with a hammer. But I will say that before I've even begun to needle, they are tense, they're holding their breath, they are just anticipating so much pain, and they get themselves all worked up. And then I put the needle in, though, and then they say, is it done? And I say, it's in. It's already in. That's it. And they go, oh, I didn't even feel that. But I will say then the rest of the treatment, if you're not relaxed and you're not breathing, those points might feel tight or feel uncomfortable where they normally wouldn't, because we are having this response of anticipation of pain. This podcast, we're going to talk about, number one, what you should feel when you go in. What does the needle actually feel like? What you should experience. And number two, what is it that's happening in us that's getting in our way and making it even more uncomfortable? And then finally, what can we do to benefit the most and take home the most results from our treatment? I'm Melissa Lone, Doctor of Acupuncture and Chinese Medicine, and this is But I Don't Like Needles. I am so excited to talk about acupuncture in this way, where it's very specific about what it feels like. I have people asking me this question all the time, and I just cannot wait to debunk all of the ideas about it, take the mystery out of it, and just really get into what you're experiencing. Now, I will say there will be a slight difference when you go and receive this, because we are all unique, and there is something very special about experiencing it for yourself. There's a lot to unpack in this episode. I'm going to go over 7 different aspects of what it feels like in an acupuncture treatment. Number 1, we're going to talk about the needles themselves. We're going to talk about the size of those needles and the gauges of those needles, because there's a variety of those. 2, everyone always asks me, how deep does it go, right? So we're going to talk about that, the depths of those. And then we're going to talk about number 3, the different styles of acupuncture and how that will also affect what it feels like. 4, what they actually feel like when you do the insertion. 5, what you feel like when you're laying down with the needles in. 6, what you feel like after the treatment when we take the needles out. And 7, what you can do to optimize your treatment, making sure that you get the best results. Number 1, the needles, they are different gauges depending on your provider, the style of provider, and where you're being needled. Let me clarify, These needles, all of them, no matter the gauge for what we use, are hairline thin. When you think of a needle that you've been used to when you go to your physician, we're looking at much larger needles, much larger gauges, and they also have what we would consider a lumen, where you are injecting something into you or extracting something out of you, i.e., we are not putting a vaccine or a medication or pain relief medication into you, which also causes discomfort, and we're definitely not with extracting anything out of you in regards to a blood draw. So these are tiny hairline thin needles, no matter the gauge or the length. We are going to have some providers that do Japanese style, where they will use extremely tiny, very thin gauge, and they will barely even puncture the skin. It's called contact needling. And they will use 10 needles, and you will feel that on the front treatment, and they will do on the back treatment. When you are looking at a more traditional TCM practitioner, they're going to use a little bit of a bigger gauge. They are going to insert the needle into the skin, and then you will feel what they call the dochi, which is a summoning of the blood and chi, and you will feel a release with that. So does it hurt? Obviously, that is the big question. Does it hurt? And my answer for that is it should not hurt. When it goes in, we have a technique where you tap past the dermis, past the layer of the skin that feels the sharp sensation. And I know it's crazy because people come in and they go, oh God, and they kind of wince and they're all worked up about what they're thinking they're going to feel. And then all of a sudden it's in and they go, oh, it's in? And I'm like, yeah, it's in. And that was that. And they look at it and it's so crazy because it just feels like a tap. That's what most of those points will feel like when they are inserted. Then at that moment, you might feel a little bit of a achy sensation over time as you lay there. It might feel like a big release if there is a little bit of a manipulation. Traditional TCM practitioners will do a little bit of a manipulation to what we would call summon the chi and blood, where you would want to get a little bit of a chi sensation. This can feel like a little achiness, or it can feel like, I like to say, a little poof sensation, a release sensation. And it will be not painful, but curious and surprising. I do TCM style. And this is what my patients like about what I do, is that they feel something happening. Now, you as a patient might be different. Some patients come in and they want to know that something's happening and they like that feeling. Some people don't want to feel anything. And for some providers, that's how it is. Not saying that one is better than the other. Not saying that one is going to have better results than the other. I really do say, as I say with many things, it depends. And it depends on the patient. And it depends on the provider. You'll want to look into that, which is why it's really great to go through referrals when you're looking for a provider, because you will get an understanding of that provider style. The other thing I want to talk about is a third style, which is a trigger point or motor point. And this style is related to the muscles in orthopedics. And that is where you will feel the muscle fasciculate. So once your muscle is locked up, which is what happens around misalignments or injury, trauma, it will lock up and it won't fire, and it'll be in a constant state of contraction. And we will use motor points. There's a different system for this. It's not related to the meridian channel therapy usually, but it is its own style, and it will be related to the nervous system and the muscular system that we know in orthopedic medicine, and it will release those muscles. Oftentimes this style is done in tandem with the meridian channel therapy for the optimal best results. But you will see that the muscle will actually contract, release. You'll see it and you'll feel it. This can be immediate relief, which is nice. It can be surprising for some people, especially when it's done over a large muscle like a glute or your pec muscle. That can be something you are looking forward to, something you want, or something you don't. So you want to look into that and you want to ask that. Again, none of it should feel sharp. None of it should feel burning. None of it should feel like I like to say, that funny bone sensation. That is a missed needle. That should be redone. That should not be what it feels like. It feels more like a release. It feels like an achiness, and it should feel better at the end of the treatment. Another question is the depth of the insertion. So you have the gauges, you have the style of acupuncture, but then you also have the different insertion depths. Always, how deep does it go? So understand that we're all unique and we're all different. And this medicine is so fantastic because it really does depend on the patient. In fact, even the needling technique in measurements and finding the points is related to the person's anatomy. I never say, oh, it's half an inch or an inch from here. Most of the time, it's related to the measurement between one bony process to another. For example, if I'm measuring the forearm between the wrist and the elbow, there's a certain amount of what they call tsun. And that tsun is the measurement. There's 12 tsun between the wrist and the elbow. And I will know that by measuring just from one wrist to the elbow, that's 12. And from there, go off to find out what their tsun is for that part of the body. So everything is measured specifically to that person, and some people, as we know, are 6'4" and have longer limbs, and their tsun is going to be much bigger than someone who's coming in at 4'11", and they have very small, smaller, shorter limbs, etc. It's going to be unique to them. So the same thing occurs with depth as well. We're keeping that in mind a little bit for that person. And we also have to keep in mind where we're needling, most importantly. So obviously the depth that is going to go on the wrists, where there's not a lot of adipose tissue, you're going to do very light needling, and it's not going to be very deep at all, barely just past the skin. When you're needling in someone's glute, again, a large muscle, and oftentimes with some adipose tissue on top of that, we need to get past that and get to the muscle, and it will be deeper, and you'll have a longer needle, you'll have a bigger gauge needle most likely, and not everybody's going to have their glutes needles. Oftentimes that relates to ortho, but it is something that'll happen, and that's going to be very different than needling someone's wrist or foot. So it depends on A, the constitution of the patient, and it also relates to where we're needling. Once the needles are in, people have different experiences. You will ideally relax. This medicine has a very unique but poignant way of getting us out of fight or flight. And you will hopefully get into this sort of kind of awake, kind of asleep, the place you would go when you are about to go to sleep. I'm not sure if I'm awake. I'm not sure if I'm asleep. When you're meditating, sometimes people get into this deep state. This is where you're quieting the frontal cortex. You are getting to those deeper levels. This is what I call the sweet spot. Ideally, this is where you will go. I'm not saying that'll happen the first visit. Sometimes we are so nervous or anxious, or there's a lot of thought going on, like, what am I feeling? That you might not get into that state. But that is where we want to get to, because that's where I believe the magic happens. But while you're laying there, you might feel some movement in the points. I like to say needles will talk to each other sometimes, where one needle will feel a little bit sore or achy or throbby, and then it'll just subside. And then you'll feel another one, and another point will sort of talk to you, and you'll feel a little achy, and then it'll subside. And then eventually, ideally, everything sort of quiets. That's the body doing its recalibration in a way. After your treatment is done, this is where you will feel what I like to call the acu-haze. We take the needles out. Sometimes they do front, sometimes they do back. And depending on the treatment plan, if you're coming in for a first visit, oftentimes we're going to do less points. We do easier treatment because if you've never had acupuncture before, we don't really know how your body is going to respond. And if your body's never tried to align itself in this way, the first time you get a treatment will be most likely the strongest. So we try to give it a little bit of a gentle treatment on that first visit, and we try to ideally get you out of fight or flight. And if you're coming in for pain, then obviously we're going to try to reduce the pain. So what you should feel when you leave depends on the treatment plan. If someone's coming in for anxiety, obviously you should hopefully be leaving feeling in the acu-haze, feeling relaxed, turned off your frontal cortex. So I don't recommend dealing with all of your money and rescheduling after your treatment. I usually recommend doing that before, when you have all of those facilities. The goal here is for us to turn all that off, so that you can, for a little while, even an hour out of the week will make a huge difference in your anxiety if you can turn that off and be in that state. But if you're coming in for deficiency and fatigue and exhaustion, then sometimes we do feel a little bit like, I'm ready to go. And that's an interesting conversation, because comparatively speaking, you'll talk to one person, oh my gosh, I always leave feeling so relaxed. And other people come out and they say, that's interesting, because when I come out, I'm ready to go and I want to go do everything. That's because you're coming in for different things. And believe it or not, the acupuncture treatment will have a treatment plan that will do what you need. So it will be different from patient to patient. But oftentimes I will say, you will feel a little bit sore, especially if you're doing a lot of ortho and we are doing that motor point and we are releasing those muscles. It's sort of like a deep tissue massage. And when you have a deep tissue massage, sometimes you're a little sore after. And it can sometimes take, in my opinion, and this is just my experience, about a day and a half to really feel the full effects of a treatment. I think especially early on when you're coming in, there's a lot of resistance to what we're doing. There's a lot of fear, there's a lot of unknowing, there's stress, there's tightening against it, there's all of those kind of experiences, and it can sometimes get in our way. And I will talk about that in a minute. You need one night's sleep to fully let your body sink in the treatment and let things go to where they need to go. I found this out personally, my experience with this, because I was doing pregnancy and inductions. So there are needle points for inductions and helping relax the uterus and descend the pelvic floor, believe it or not. And these are useful points for helping move things along when it's 40 weeks and we have to get baby going and get a birth started. And so I do use those points, and I've noticed that sometimes it happens that night, but oftentimes it's actually the next night. And that's kind of a pattern I've noticed. It's not necessarily right away, but it can sometimes be a night or so, because I think they sleep on it, honestly. And when we finally sleep, we finally relax, and we finally let that treatment sort of sink in. So just know that sometimes you'll be a little bit sore, or there'll be this little bit pushback maybe. And then after about a day, you say, oh, I feel better. That's very common for treatments in my experience. That's not always the case. Ideally, I do have the majority of my patients will leave and they say, I'm better than I came in. And that's what we're shooting for. It might not be 100%, not be perfect, but you should leave saying, I have some relief. If I came in with an 8 out of 10, you should be leaving with, at least a 6 out of 10 or 5 out of 10 or something. Something is definitely better. Something is definitely happened. You feel more relaxed. You feel less pain. And what you want to know too is visits will sometimes work for 3 or 4 days and things will want to slip back. So that's especially important to understand when it comes to chronic conditions. Our bodies are very used to being in a certain misalignment, and you can put it in, but then it'll want to slip back. So you have to keep reminding it. And that's why we often recommend 5 or 6 treatments, either once a week or twice a week or even 3 times a week, depending on the severity, to remind the body to keep putting it back into its proper place. And that's also why we will put exercises or stretches in tandem to help hold the treatments. And same thing with herbs and things when it comes to internal stuff, is to help support that treatment. I recommend that after treatment that you don't necessarily go into a rigorous exercise. Obviously, if you're an athlete, you're going to do that probably, and you do what you got to do, and it's actually might be useful and helpful for that person. But oftentimes, I think it's good to relax and try to take it easy. Our body heals when it sleeps. So oftentimes after treatment, I will have people say to me, I slept better than I ever have slept before. And that is because your body needs to sleep, and that's when it heals. So that's the basics of what it'll feel like. And like I said, it'll all depend on each individual, and it depends on what you bring to it when you come in. And this is the final thing I'll say. The breath is so important. And when you come in, the mindset and the breath work is everything. When you breathe in with a point and breathe out with a point, that is going to help the treatment. And if you are welcoming to the treatment, you will have a better treatment. If you are accepting the feelings that you feel instead of being afraid of those new feelings and panicking and tightening around those new feelings, it's only going to make the treatment more uncomfortable and make the treatment take longer to reach our goal. So what you can do coming into a treatment is be open, be willing, and then using our breath. When I usually have that happen with my patient is that when I'm about to breathe, I give them a little heads up, I give them a little tap so they know it's coming. I have them breathe in and breathe out, and that helps with the breath to move the blood, move the chi, move the point, and so you will be able to receive the treatment better and have better results. Thank you for listening and being a part of the conversation today. If you enjoyed it, please like us or leave a comment in the comment section. We would love your feedback, and we are open to topics that you would like to discuss. And better yet, if you know anyone that may benefit from this information, either they're suffering, they're in pain, or they're just curious about trying this medicine but they don't like needles, please share this podcast. As I always say, wellness is as contagious as the flu.